Hey everyone, welcome back to the channel. Today, we're diving into an important topic for anyone affected by lupus, understanding pharmacotherapeutics, or how medications are used to manage lupus. Whether you're newly diagnosed or have been living with lupus for years, knowing how your treatment works is key to staying informed about your health. First up, we have anti-inflammatories such as non-steroidal anti-inflammatory drugs, NSAIDs. These help reduce the inflammation and pain that lupus causes, especially in the joints and muscles. Think of inflammation like a fire. It's your body's natural response to injury or infection. But with lupus, the immune system mistakenly attacks healthy tissues, causing unnecessary inflammation. NSAIDs work by blocking the production of chemicals called prostaglandins, which trigger pain and inflammation. You're probably familiar with common over-the-counter NSAIDs like ibuprofen, Advil, Motrin, or naproxen, Aleve. These can be helpful for mild lupus pain. However, your doctor might prescribe stronger NSAIDs if needed. It's important to remember that NSAIDs, while effective, can have side effects like stomach upset, heartburn, or even ulcers with prolonged use. Always talk to your doctor before starting any new medication, even over-the-counter ones. Your doctor can help you weigh the benefits and risks and determine the right dosage for you. They can also recommend strategies to minimize potential side effects, such as taking the medication with food or using an antacid. Beyond managing pain and inflammation, NSAIDs can also play a role in protecting your organs from long-term damage. By keeping inflammation in check, they can help preserve the health of your kidneys, heart, and other vital organs. Living with lupus is a marathon, not a sprint. Finding the right treatment plan is an ongoing journey, and NSAIDs can be a valuable tool in your arsenal. By understanding how they work and using them safely, you can take an active role in managing your condition and improving your quality of life. Remember, open communication with your healthcare team is crucial. Don't hesitate to ask questions, express your concerns, and discuss any side effects you may be experiencing. Together, you can find the best approach to managing your lupus. Next are corticosteroids like prednisone. These are powerful anti-inflammatory drugs used to control severe lupus flares. They're effective but can have serious side effects, especially with long-term use, so they're often used in short bursts or in combination with other medications. Corticosteroids work by mimicking the action of cortisol, a hormone naturally produced by your adrenal glands. Cortisol has potent anti-inflammatory effects, suppressing the immune system's overactivity that drives lupus. Due to their rapid and potent action, corticosteroids are often used to manage acute lupus flares, especially when vital organs are involved. They can quickly bring down inflammation, reduce symptoms, and prevent further damage. However, long-term use of corticosteroids comes with a higher risk of side effects, including weight gain, increased blood sugar, thinning bones, and a weakened immune system. That's why doctors aim to use the lowest effective dose for the shortest possible time. Think of corticosteroids as a fire extinguisher, highly effective in an emergency, but not meant for everyday use. Your doctor will carefully monitor you while you're on corticosteroids and gradually taper the dose as your condition improves. While the potential side effects might sound daunting, it's crucial to remember that corticosteroids can be lifesavers during severe lupus flares. They can prevent irreversible organ damage and provide much-needed relief from debilitating symptoms. If your doctor prescribes corticosteroids, it's essential to follow their instructions carefully and attend all follow-up appointments. They will closely monitor your response to the medication and adjust the dosage or duration of treatment as needed. Remember, knowledge is power. By understanding how corticosteroids work, their potential benefits and risks, you can make informed decisions about your treatment and work collaboratively with your healthcare team to manage your lupus effectively. Chapter 3. Antimalarials, a surprising weapon against lupus. One of the most interesting classes of drugs used in lupus is antimalarials, like hydroxychloroquine. Originally developed to treat malaria, these drugs help reduce lupus-related inflammation, particularly in the skin and joints. They're usually taken over the long term to prevent flare-ups. You might wonder how a drug designed for malaria can help with an autoimmune disease like lupus. Well, it turns out that antimalarials have unique properties that extend beyond fighting parasites. They can also modulate the immune system and reduce inflammation in a way that benefits people with lupus. Hydroxychloroquine, commonly known by the brand name Plaquenil, is the most widely used antimalarial for lupus. It's often prescribed early in the course of the disease to help control symptoms, prevent flares, and protect against organ damage. Unlike NSAIDs or corticosteroids, which provide relatively quick relief, antimalarials usually take several weeks to months to show their full effect. It's like slowly turning down the heat on a stove, rather than extinguishing a fire. The beauty of antimalarials is that they are generally well tolerated, even with long-term use. While side effects are possible, they are usually mild and manageable. Common side effects include stomach upset, which can be minimized by taking the medication with food. In addition to their anti-inflammatory effects, antimalarials have been shown to have other benefits for people with lupus, such as improving skin rashes, reducing joint pain, and even protecting against heart disease. If your doctor prescribes an antimalarial, it's important to remember that consistency is key. Take the medication as directed, even if you start feeling better. Skipping doses or stopping the medication abruptly can trigger a flare. Antimalarials are a valuable tool in the long-term management of lupus. By working closely with your doctor, monitoring your progress, and addressing any concerns, you can harness the power of these medications to live a healthier, more fulfilling life. Chapter 4. Immunosuppressants. Calming the immune storm. Another critical part of lupus treatment is immunosuppressants, such as azathioprine or mycophenolate. These medications help dampen the immune system's overactivity, which is what causes lupus symptoms in the first place. By suppressing the immune system, they help prevent organ damage and control serious symptoms. Imagine your immune system as an army. Its job is to protect your body from invaders like bacteria and viruses. But in lupus, the immune system gets its wires crossed and starts attacking your own healthy tissues. This leads to the widespread inflammation and damage that characterizes the disease. Immunosuppressants act like skilled diplomats, calming down the overzealous immune system and preventing it from causing further harm. They work by suppressing the production or activity of certain immune cells that are involved in the attack on your body. Due to their potent effects on the immune system, immunosuppressants are typically reserved for moderate to severe cases of lupus, especially when vital organs like the kidneys, heart, or lungs are affected. While immunosuppressants can be highly effective in controlling lupus and preventing long-term complications, they also come with a higher risk of side effects. Because they suppress the immune system, they can make you more susceptible to infections. Your doctor will carefully weigh the benefits and risks of immunosuppressants, considering the severity of your lupus, your overall health, and your individual risk factors for infection. While on immunosuppressants, it's crucial to be extra vigilant about your health. Wash your hands frequently, avoid close contact with sick people, and report any signs of infection, such as fever, cough, or sore throat, to your doctor immediately. Despite the potential risks, immunosuppressants have revolutionized the treatment of lupus, enabling people with the disease to live longer, healthier lives. By working closely with your doctor, understanding the potential side effects, and taking steps to minimize your infection risk, you can safely harness the benefits of these powerful medications. Chapter 5. Targeted Therapies and Biologics. The Future of Lupus Treatment. Now let's talk about targeted therapies and biologics. These are newer treatments designed to target specific parts of the immune system. For example, belimumab, known as Benlysta, blocks a protein involved in lupus flare-ups. These options are part of personalized treatment plans and are often used when traditional therapies aren't enough. Targeted therapies and biologics represent a significant advancement in lupus treatment. Unlike traditional immunosuppressants, these newer drugs hone in on specific pathways, minimizing off-target effects. Biologics are derived from living organisms and block specific proteins or immune cells. They help reduce inflammation and tissue damage in lupus. Belimumab targets BLyS, reducing harmful antibodies in lupus. By blocking BLyS, belimumab calms the immune system and prevents damage. It's like disarming a specific group of soldiers within the rogue immune army. Targeted therapies and biologics are often used with traditional lupus medications. They may also be an option for those who haven't responded well to other treatments. While they offer new hope, they are not a cure. They help control the disease and prevent flares, but don't eliminate lupus entirely. As research continues, more targeted therapies and biologics will emerge, offering new possibilities. Talk to your doctor to see if these treatments might be right for you. They can discuss the potential benefits, risks, and costs to help you make an informed decision. If you're living with lupus, remember that you are not alone. Your healthcare team is there to guide you, and learning more about your treatment options can help you feel empowered to take control of your health. Always talk to your doctor about any concerns or questions you have regarding your medications. It's essential to stay informed about the benefits and potential side effects of your treatment. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more content on living with chronic illnesses like lupus. And if you have any questions or experiences you'd like to share, drop them in the comments below. I'd love to hear from you. Until next time, take care and stay strong.